Welcome to the Psychology and Physical Training channel, Prevalence of Schizophrenia. Did you know that schizophrenia affects approximately 1% of the global population? That's right. This complex mental disorder is more common than you might initially think, found across every corner of the world, emerging regardless of race, ethnicity, or socio-economic status. Schizophrenia, a global phenomenon. Schizophrenia typically reveals itself in the late adolescence or early adulthood period of an individual's life. Interestingly, it tends to show up earlier in men than in women. But why does this matter? Well, this timing often disrupts critical moments in education, career development, and the establishment of healthy social relationships, amplifying the disorder's overall impact. While 1% might seem like a small number, the ripple effects of schizophrenia are anything but tiny. When you consider the individuals directly affected, their families, friends, the communities they're part of, and indeed society as a whole, the reach is substantial. Despite its seemingly low prevalence, schizophrenia's impact on those affected, their families and society at large is substantial. Understanding schizophrenia. Now, what exactly is schizophrenia and how does it manifest in individuals? Schizophrenia is a chronic, severe mental disorder that affects how a person thinks, feels, and behaves. It's as if the mind has lost touch with reality, creating a world that is often frightening and confusing. At its core, schizophrenia is characterized by a broad spectrum of symptoms, which can be broken down into two main categories: positive and negative symptoms. Positive symptoms, in the context of schizophrenia, refer to the addition of behaviors or experiences that are not normally present. This includes hallucinations, delusions, and disorganized speech. Hallucinations are sensory experiences that occur without an external stimulus. In simpler terms, it's like seeing, hearing, or feeling things that aren't really there. Delusions, on the other hand, are false beliefs held with conviction despite clear evidence to the contrary. They might include beliefs of being persecuted, being a famous personality, or having extraordinary powers. Disorganized speech, also known as word salad, refers to jumbled and incoherent speech, making it difficult for the person to communicate effectively. Negative symptoms represent the absence or reduction of behaviors or experiences that are normally present. These might include a flattened affect, which means a person's face appears immobile and unresponsive, or alogia, a reduction in the amount of speech. Another example is avolition, or a lack of motivation to engage in activities that were once enjoyed. These symptoms, both positive and negative, can significantly affect an individual's ability to function. They may struggle with tasks we often take for granted, like maintaining personal hygiene or holding a job. It's crucial to remember that the severity and combination of symptoms can vary greatly from person to person. It's also important to note that schizophrenia is not synonymous with a split personality or multiple personality disorder, a common misconception. It's a unique and complex disorder in its own right. As we can see, schizophrenia is a complex disorder characterized by a range of symptoms that can greatly impact an individual's life. Causes of schizophrenia. But what causes schizophrenia? A question that has intrigued and baffled the scientific community for centuries. The answer isn't straightforward, and that's because schizophrenia is a complex mental disorder with an intricate web of potential causes. Firstly, let's delve into the role of genetics. It's been observed that schizophrenia can indeed run in families. However, it's not as simple as inheriting a single schizophrenia gene. Rather, there are likely numerous genes that increase the risk of developing schizophrenia, each contributing a small amount to the overall risk. It's also important to note that while these genes may increase the risk, they do not guarantee the development of the disorder. Next, we turn to brain chemistry and structure. Researchers have discovered that people with schizophrenia often have subtle differences in their brain structures, such as enlarged ventricles. They also tend to have an imbalance of certain chemicals in the brain, particularly dopamine and glutamate. This imbalance can affect the way the brain reacts to stimuli and can lead to the symptoms of schizophrenia. Lastly, we must consider environmental factors. This could include exposure to viruses or malnutrition before birth, complications during birth, and psychosocial factors. High stress levels, for instance, can trigger schizophrenia in people who are genetically predisposed to the disorder. However, it's important to emphasize that none of these factors alone is sufficient to cause schizophrenia. It's the combination of genetic vulnerability, brain chemistry, and environmental stresses that likely leads to the development of the disorder. It's a bit like baking a cake. Having flour alone doesn't make a cake, but combine it with eggs, sugar, and heat, and you've got yourself a tasty treat. Similarly, having a genetic predisposition doesn't automatically result in schizophrenia, but combine it with imbalances in brain chemistry and certain environmental factors, and the likelihood increases. Though the exact cause remains unknown, it is clear that schizophrenia is not the result of any one factor, but a complex interplay of genetic, biological, and environmental factors. Treatment options for schizophrenia. Despite the challenges that schizophrenia presents, there are treatment options available. Let's delve into the primary strategies that medical professionals and therapists use to help those living with this often misunderstood disorder. The first line of defense is typically antipsychotic medications. These drugs help to regulate brain chemistry and manage hallucinations, delusions, and disorganized thinking. They're not a cure-all, but they can often provide the stability needed for individuals to engage in other forms of treatment. Next, we have psychosocial treatments. This broad category includes therapies that focus on improving communication skills, managing everyday tasks, and dealing with the stress that often accompanies schizophrenia. Cognitive behavioral therapy, or CBT, is one such treatment. It helps individuals challenge distorted perceptions and change negative thought patterns. Another effective approach is social skills training, which can assist in improving communication and social interactions, both of which can be challenging for those with schizophrenia. Lastly, we have something called Coordinated Specialty Care, or CSC. This is a team-based approach that combines medication, psychosocial therapies, case management, and work or education support. The goal is to treat the whole person, not just the symptoms. It's about understanding that schizophrenia affects every aspect of an individual's life, and therefore a comprehensive treatment plan must address all those areas. It's essential to remember that each person's experience with schizophrenia is unique, and so too should be their treatment plan. Working closely with healthcare professionals and loved ones, individuals can tailor a plan that fits their needs and lifestyle. Also, it's crucial to emphasize that treatment is a journey. It's not a one-time fix, but a continuous process of managing symptoms, navigating life's challenges, and striving for a better quality of life. With the right treatment plan, individuals with schizophrenia can lead fulfilling and meaningful lives. There's hope, and with continued research and understanding, that hope grows stronger every day. Key takeaways about schizophrenia. So, what are the key things to remember about schizophrenia? Schizophrenia is a serious mental health condition that affects about 1% of the global population. It's not as common as some other mental health disorders, but its impact is significant and far-reaching. This disorder manifests with a spectrum of symptoms, which can be broadly classified into positive, negative, and cognitive symptoms. Positive symptoms are those that most individuals do not normally experience but are present in people with schizophrenia, such as hallucinations and delusions. Negative symptoms are capabilities that are reduced or absent, like diminished emotional expression or lack of motivation. Cognitive symptoms pertain to problems with thought processes and memory. The causes of schizophrenia are multifaceted, combining genetic, environmental, and psychological factors. There's no single gene or event that triggers schizophrenia. Rather, it's a complex interplay of many factors. Prenatal exposure to viral infections, malnutrition, complications during birth, psychosocial factors, and even certain substance use can increase the risk. When it comes to treatment, there's no one-size-fits-all approach. Antipsychotic medications are typically the first line of treatment, aiming to manage the severity and frequency of symptoms. Psychotherapy, including cognitive behavioral therapy and social skills training, can also play a pivotal role in helping individuals manage their symptoms and lead productive lives. In some cases, hospitalization may be necessary for those who pose a danger to themselves or others. It's crucial to remember that schizophrenia is not a character flaw or a sign of personal weakness. It's a medical illness that requires understanding, compassion, and appropriate treatment. Despite the challenges it poses, schizophrenia is not a life sentence. With a comprehensive and individualized treatment plan, individuals with schizophrenia can manage their symptoms and lead fulfilling lives. They can pursue their dreams, form meaningful relationships, and contribute positively to society. Remember, schizophrenia is not a life sentence. With understanding, empathy, and appropriate treatment, individuals with this condition can live full and rewarding lives. And if you like this video, do not forget to subscribe and follow the Psychology and Physical Training channel for more videos. Thanks for watching.